Is there any update when Nebraska may receive rapid tests? I believe what Sarah's referring to is something the President talked about on his phone call earlier this week. There is a test from Abbott Labs that supposedly will get done in 15 minutes. We have been told that we will receive some of those machines and some of the assays, but as I said earlier, we have not been given a timeline from FEMA as to when we will actually receive those. So, again, this is part of our strategy to work with the federal government, but I don't have a timeline on those. Could you walk us through the process of a hospital or clinic getting a COVID-19 test? Is the state involved, or can providers get tests on their own? How are these tests divided out? What determines what number in each will be provided? So again, I'll just kind of hit upon some of those points I hit before. So if, again, you've got those symptoms, those flu-like symptoms, you've got the cough, you've got the shortness of breath, you've got the fever, stay home. First thing you do, stay home. Contact your healthcare provider. Let them know that you've got this and you want to come in. They'll make an appointment for you so that you can stay isolated. That way we don't infect an entire clinic or an emergency room just by showing up. So this is very important. They will run you through the screens of testing you for influenza A and influenza B. Then the healthcare provider will have the option of doing that respiratory panel we talked about before, but it will now be optional. This is part of the ways we're expanding the testing to give the healthcare provider the discretion to say that panel's not necessary. That panel can be expensive, as we've talked about in the past. Sometimes it takes a while to get done, so the healthcare professional then has the discretion to waive that panel and then go into the other screeners we talked about. So again, has the person traveled overseas? Has the person traveled domestically? Are they one of those people we just talked about? Somebody who works in our 24-hour facility, somebody who's a healthcare worker, somebody who has been in a nursing home or other kind of facilities like that. Somebody who maybe has an underlying illness or is 65 years or older. You know, those are all going to be conditions for somebody to be prioritized to get that coronavirus test. So that's what we are looking for, to be able to get that turned around at the public health department. Now, other providers can go out and go to commercial labs like LabCorp and Quest. Those tests generally take 4 to 7 days to turn around, but I think, Dr. Anton, we're getting about 200 of those. We got about 200 yesterday, is that about right?
About 200 returned every day now for the last several days.
Yeah, so we've had about 200 of those returned now every day for the last several days. So other healthcare providers are going to those commercial labs. They take a little bit longer, but they are able to do that as well, and so that's part that goes into the overall 696 that we tested yesterday. So yes, other healthcare providers can get that as well. And then, and again, they're divided up based upon that criteria. So if you're in a rural area, if you're in an urban area, it's the same screen to be able to get that coronavirus test. We also, for example, if we have a situation like we did with Carter House and Blair, we will go in and we will test the residents, we will test the healthcare worker or the workers there and so forth. So that's another instance of where we will prioritize testing.